So we are doing anesthesia monitoring for Ghost right now. Here's our monitoring machine. And what we usually want to start with is a live check. I will usually feel for a femoral pulse underneath the leg. Alternatively, you can listen to the heart. Or you can watch the chest rise and fall, which is showing our breathing. We also want to make sure that we're at an appropriate depth, so we'll check our palpebral response, which is absent. We'll check our eye rotation, so we are ventral and central, so we're pretty deep. And then jaw tone is good, so we are doing well, and we are at 3 for ISO right now. So up here we have the top number that says 168 is the heart rate calculated by the EKG leads. We usually will place them, the white lead goes on the right side, so white is right. And then on the left, smoke over fire, so we have black is our smoke. And then red is our fire. Then we're gonna look at our EKG waveform, which is up here. And we have a P, QRS, and T for every complex, which is good. If you ever want to know what a normal EKG looks like, that's right at the top. These are some abnormalities you might see. Underneath we have our blood pressure reading, so we have systolic, diastolic, and mean arterial pressure, so 111/68, MAP is 82. We placed our blood pressure cuff with the tubing going towards the machine. And then underneath we have our SpO2 pulse ox. So we placed that on the tongue. Alternatively, we can go on the ear or the prepuce or vulva. And then our heart rate that we're getting from the pulse ox is typically more accurate than from the EKG leads. You can always verify that by feeling for a femoral pulse or, again, listening to the heart. Lastly, we have our capnograph. Again, our tubing is going towards our machine. And this is showing our respiratory rate and then our end tidal CO2. Our respiratory rate we can also verify by watching. Again, for the breaths, end tidal CO2 we want to maintain a target range between 35 and 45. If it gets to be 70 or higher, you want to give a breath here. You would hold down the top button. We'll demonstrate. Squeeze while the button is held down. Go up to 10, and then you'll release. If your patient is waking up and you turn up the ISO so they fall back asleep, that also helps you deliver the ISO more quickly to help them.
It takes 10 minutes for it to set in.
And it takes about 10 minutes for that to kick in. And then...
So what he's getting as far as gas is going through this tube into there.
Yep.
What he's breathing out is going into the clear and going out and being filtered into the soda sorb.
Yep. Exactly. And then our last part of monitoring is our temperature, which we have here. And then our fluids, which we have in our fluid warmer. There's our fluid rate. And then that is going through here into his catheter. And then, like Whitney said, there's 2 tubes in here. One carries the gas and oxygen inside. This is our flow meter, which has our oxygen concentration. It combines with the isoflurane, so these are 2 different rates that you're going to set, and then it's delivered to the patient. Comes back out. It's filtered through there, which is specific to a rebreather circuit for larger animals or animals over about 8 pounds. And then from here, we scavenge our waste, comes up through here, Here's our reservoir bag, and then goes into the ceiling for our scavenging system. And then green is our oxygen. We can trace that. We can see that that's going in this side, and that is our flow meter. So you can see that, and the green is attaching to here. And then this is our actual bag that we choose based on our patient's weight. Versus this one, reservoir just has to be a little bit bigger than this bag. So Ghost is how many pounds?
He is 83 pounds and he's 36 kgs.
Okay, and then we have him on a 3-liter bag right now.
Or has